A 50-year-old man presents to a clinic with a skin lesion on his forearm, which recently changed in color from light brown to brown-black. The lesion was initially pinhead in size but now has grown to the size of a penny. On examination, there is a 3.5 times 2.5 centimeter irregular shaped lesion on his left forearm. A photograph of the lesion is presented. A biopsy of the lesion shows nests of pigmented melanocytes with few areas showing invasion into the superficial dermis. The physician talked to the patient about a new drug, monoclonal antibody against the cytotoxic T lymphocyte associated antigen 4, CTLA4 molecule, that has recently been launched in the market for his condition. The CTLA4 molecule usually interacts with which of the following on the antigen-presenting cells? The correct answer is E. The clinical features in this patient and the picture indicate a melanocytic lesion that is confirmed to be a malignant melanoma by the biopsy findings of invasion into the dermis. Melanomas typically change in color and show a rapid increase in size within a short period of time. The new drug physician is talking about is a monoclonal antibody called ipilimumab that binds to CTLA4 and blocks it. However, in the absence of blocking agents like ipilimumab, the B7 molecules on antigen-presenting cells interact with the CTLA4 present on T cells. T cell immune function is negatively regulated by CTLA4, which acts as an immune checkpoint. There is increased activation of the immune system through inhibition of CTLA4. CD28 is a homologous molecule and is similar to CTLA4, but the CTLA4 has a higher affinity to B7. As shown in the figure below, the relative binding of CD28 with B7 versus CTLA4 with B7 determines the T cell activation. A positive activation signal and interleukin-2 proliferation with increased survival of T cells occur when CD28 binding with B7 predominates in a setting of weak T cells receptor signal. However, in the case of a stronger signal, the binding of CTLA4 with B7 predominates, resulting in decreased T cell survival. This patient has melanoma and ipilimumab a monoclonal antibody that attaches to CTLA4 is used in a treatment of melanoma. The binding of this monoclonal antibody to the CTLA4 molecule prevents other molecules from binding to it. The exact mechanism is not clear, but data suggests that blockage of CTLA4 causes activation and proliferation of T regulatory cells. As shown in the figure below, these T cells induce an immune response against tumor cells, causing the elimination of tumor cells. There are several fusion proteins of CTLA4 and antibodies like a beta-cept that act as antagonists to reduce immune activity. They are used in the treatment of autoimmune diseases like rheumatoid arthritis. A second-generation drug, belatacept, has been used in the treatment of renal transplantation patients who are sensitized to the Epstein-Barr virus. Option A, major histocompatibility complex class 2, which is present on the antigen-presenting cells, interacts with the T cell receptor. This interaction causes the activation of CD4 T lymphocytes. Option B, major histocompatibility complex MHC class 1, also interact with T cell receptor on CD8 positive T lymphocytes. This interaction causes the activation of CD8 T lymphocytes. Option C, T cell receptors interact with MHCs, not CTLA4. Option D, CD28 molecules present on the T cell interact with B7 molecules present on the antigen-presenting cells. Learning objective: B7 molecules present on the antigen-presenting cells interact with the CTLA4 molecules present on the T cells. CTLA4 blocking agents such as ipilimumab and belatacept are used in the treatment of melanoma and prostate cancer. Antagonistic antibodies against CTLA4 cause an increase in immunity against the tumor cells. Fusion proteins of CTLA4 and antibodies CTLA4-Lig act as antagonists to reduce immunity, which is helpful in the management of autoimmune diseases.